Good morning. I'm Bob Sanborn. I'm President and CEO of Children at Risk. And we have a panel of experts today to talk a little bit about the projected rise in the Affordable Care Act, the insurance costs therein, and how these changes are really going to impact our workforce in Texas, our economy, and the future of our children here in the state of Texas. Our panel, a fantastic group. We have Dr. Ann Barnes with us. She's the President and CEO of the Episcopal Health Foundation in Houston. Out of San Antonio, Mary Gar, who's the president and CEO of Family Service San Antonio, the largest social service agency in that area. Dr. Adriana Rocha Garcia, president and CEO of the Center for Health and Empowerment in South Texas. Dr. Rocha Garcia, thank you very much for being here with us. Today, as we go through this, I think it's going to be important for us to understand the history and where we're going, and really the impact that we see here on our families and children. This is an issue that our country has been working on for some time. It's sort of hard to believe, but it was 15 years ago that the Affordable Care Act was passed. And the whole idea is, how do we make this better for our population? And that's why we passed the Affordable Care Act. It's been controversial from the beginning, with people saying that there's probably a better way to do this. Maybe this isn't the perfect system. But I often say it's sort of like it's your old rickety car. You either replace it or you fix it. You don't really get rid of it. And I think that's what we're seeing right now, is that there's a movement to say, let's get rid of the Affordable Care Act, but without a fix or replacement on the horizon. It seems very hard, and very hard on our citizenry, to say, just wait a year or a couple of years and then you'll have insurance again. And so for us, it's really coming down to, how do we take care of all of those families, all those children in the state of Texas, without saying you have to go without for some time. And I think what's really important right now is looking at some of the costs. When some say that this system that we have now is too expensive, I remember back 15 years ago when counties were complaining that when people didn't have insurance, it would all come back to their waiting to see a doctor, and then having to go to the emergency room, and the county having to cover those costs. And so whether we pay it through the federal government like we're doing now, or we pay it through our county taxes, our state taxes, one of those things is going to happen. And so we often have to look at how are children, how are families best served? And right now, they are best served through us subsidizing the Affordable Care Act. This really seems to be the best way, without any other ways on the horizon. Texas historically has had high rates of uninsurance for families and for children. One of the highest in the nation when it comes to our children. 16% of Texans are uninsured. That's about 5 million people. They don't have health insurance. That includes about 800,000 children who are growing up without consistent access to routine care. And so to think that we're going to increase those numbers by doing what we're doing seems really horrendous. Already, when we look at the data, Houston and Dallas have the two highest rates of uninsured children of any city in the developed world. And it seems hard to imagine that, but the reason is because the rest of the developed world has universal health care. We are the only country in the developed world that doesn't have that. And I'm not saying we have to be like every other country, because I know in Texas we don't like to compare ourselves to other countries and what they may be doing well or wrong. We want to do our own thing here in Texas, here in the United States. But I think our own thing really has to include taking care of our children health-wise. When we look at the economic impact of this, one of the things that we understand is that families are going to be forced to make decisions that are going to be very difficult for them. If these costs indeed increase the way that they're projected, sometimes doubled for families over the course of a year, they're going to have to choose these insurance plans over rent, over groceries, over their children's education, extracurriculars in some cases. And so it's just not a fair decision, because we know that every parent wants their child to be successful. They're going to do whatever is necessary to make sure that that child is successful. And we can't be piling on some of these costs for these kids. What happens when they have these expensive costs is that they will miss preventative visits. They're going to miss critical medications. They're going to really find that things that are more serious and more expensive to treat are that much more expensive, and they're going to be ending up in the emergency room, like I mentioned earlier. When we look at the scale of impact here, families at every level of the economic spectrum are going to feel the impact of increased healthcare costs. I think that's just really important to understand because enrollment will drop, and hospitals and providers will have to shoulder more of that uncompensated care. Family premiums, of course, are projected to double, and we're already stretched to that breaking point. And every community is going to feel this impact. Every community in Texas, whether you're urban, suburban, or rural, you're going to have higher healthcare costs. There are going to be workforce challenges, declining community health outcomes, all because children are going to lose this access to affordable care. What we really want to see is a strong economy. And to have that strong economy, we need healthy children and healthy families. Those healthy children need access to a bright future. So, what we're encouraging here today, and we work with people from all political stripes on this, but we just need them to understand that we want Texas families and children to be considered when it comes to making these decisions. Let's not leave them without a means to stay healthy, without a means to improve their future, without a means to contribute to the economy. Texas families really can't afford economic setback, but the decisions that are going to be made in Washington in the next few weeks are going to determine whether millions of Texans can continue to see a doctor, afford life-saving medications, and really keep their children healthy. Today, we brought all these experts to really focus on this issue because we've been so overcome with this whole idea of the government shutdown that we really haven't focused on the cost of medical care and the cost that we will potentially see with these insurance rises. So anyway, let's go to Dr. Ann Barnes. She's out at the Episcopal Health Foundation in Houston. She is a physician herself. And of course, leading a great philanthropic organization. Dr. Barnes, give us your take on what this could all mean for us.
Thanks, Dr. Sanborn. Really appreciate the opportunity to be here. Episcopal Health Foundation has tracked Affordable Care Act enrollment in Texas for more than a decade because we know that health insurance is a key part of staying healthy. It connects people to preventive care, crucial screening, chronic disease management, and the everyday services that keep families well. The trend in Texas has been really clear. When health insurance coverage is affordable, Texans enroll. Since 2021, the ACA enrollment has really surged, growing from over 1.2 million people to nearly 4 million people today. That growth was spurred by the enhanced ACA subsidies, which you've already mentioned, and has really helped drive down the uninsured rate here in our state. Millions of Texans now have access to care that they didn't have before. A new Texas A&M Bush School study funded by EHF shows what we stand to lose if Congress lets subsidies expire. The report finds that more than 1.4 million Texans could lose ACA coverage and 800,000 could become uninsured altogether. Premiums could spike sharply, and we're already hearing stories about that. And in some rural communities, families could see costs double, even triple. Affordability is the tipping point between having insurance and losing it. When we analyzed county by county trends, we saw that rural areas experienced some of the largest increases in ACA enrollment. Waller County grew from just a few thousand enrollees to nearly 25,000. South Texas counties like Hidalgo, Star, and Maverick saw major gains as well. And large metro counties continued steady growth. Coverage expanded everywhere. And just as you said, it touches rural and urban communities. We recently heard directly from Texans in a focus group in Greater Houston. Participants said affordability is the single biggest factor in whether they can keep coverage. Many already struggle to make ends meet, and several said that without subsidies, they would have to choose, as you just mentioned, between health insurance and paying for food, rent, or utilities. If enhanced subsidies expire, Texas will see more uninsured families, more unpaid hospital bills, and more pressure on rural hospitals and major health systems, especially safety net healthcare systems, who are already coping with uncompensated care. That affects every community in our state. This isn't just a budget discussion either. It's a decision about whether families can keep access to basic care and maintain financial stability. Continuing enhanced premium tax credits would help Texas protect the progress we've made and keep health insurance within reach for families who really have come to rely on it. Thank you.
Thank you very much, Dr. Barnes. And thank you for all the work that you guys do at Episcopal Health. It really helps our state so much. Let's go to Mary Garr out in San Antonio. She's the president and CEO of Family Service San Antonio, the largest social service organization in the city of San Antonio. Mary, from your perspective, and you're sort of on the ground there, you and your team, what are you guys seeing, and how can this have an impact on families and children in San Antonio and across Texas?
Bob, thank you. And I'd like to give some bigger context to add with what Dr. Barnes was saying. You know, we're talking about here in Texas, but understanding how we compare also across our nation. And as we know, when the Affordable Care Act was first implemented, that gave access to millions of people who previously were not receiving care or inadequate care because they could not afford it, because it was not available to them. We ration healthcare in our country based on people's ability to access care, which is primarily through health insurance here. And when the pandemic hit and they added in the subsidies for the Affordable Care Act, as Dr. Barnes said, you know, when you're looking nationwide from 2021 to 2025, we went from 11 million insured under the Affordable Care Act to almost 25 million insured. And most of that increase, they said, was due to the ability to have those subsidies to bring affordability to healthcare insurance for people. And who's accessing that insurance? A lot of times it's those who have retired but not yet reached age 65, so they're not eligible for the Medicare insurance yet. Here in Texas, because you know we don't have extended Medicaid, the limitations on income to be able to access Medicaid are very high, so very few people can access here. So people who don't have insurance through their employment, they're that poor, you know, working level here without insurance, or they do have insurance through their employer, but they're really functionally uninsured because they can't afford their premiums and deductibles and co-pays. And so they're not accessing health care. And then also, if you think about youth who are in college and either aged off their parents' plan, if their parents had one, or if they are, you know, in school, they're taking that risk of not having insurance. And then so many others out there. But when you're thinking about the average person, and then you're adding in the low income component, where we already struggle with health literacy and nutritional literacy, and how are people able to access healthcare when healthcare by itself is complex, even when we understand the system, we create this confluence of barriers and challenges for people who generally are in jobs where they already are at higher risk for injury or long-term disability without adequate access to healthcare. We see these individuals and families coming into us. We did before the Affordable Care Act. We've done since then. We've seen the improvement with the subsidies that have been brought in, where people are able to be stabilized, because we'll see people coming in with tremendous medical debt that they just can't pay off. And the number one reason for bankruptcy in the United States is medical debt. But then from there, they also come in because they've had to stop working because they are injured or sick, or they've had to stop working because they've had to become a caregiver, thus putting tremendous stressors on family income. They're making choices on either buying food, paying rent and utilities, or accessing healthcare or procuring their medicine. And when you're talking about things like diabetes and heart disease, you know, and all the other stressors that we see in our health system and healthcare status today in our country, it becomes harder and harder. And this also explains why our healthcare status is decreasing over these last 3 decades. We rank 47th for men and 42nd for women in health status in the United States. That is less than many what we would consider developing or third world countries who have that universal access to healthcare. We should have access to healthcare just like we should be able to feed everybody and have safe, affordable housing for everyone. These aren't just commodities. These are ways that we can help keep people alive, not just with good quality of life and productivity, but being engaged, healthy, productive citizens in their own communities. We don't do that very well today, and we can do better.
Thank you very much, Mary, and thanks for all the work that you and your team are doing. Dr. Adriana Rocha Garcia is president and CEO of the Center for Health Empowerment in South Texas. Dr. Rocha Garcia, I wonder if you might give us your take, and I'll ask you a question in Spanish para la prensa español after this, but give us your take.
Yeah, well, one of the things that we're seeing as we're talking to families out in the community is that they're going to have to prioritize certain things. You mentioned earlier, for instance, housing. And people already are stressed and there's not enough affordable housing, so they have to pay for their home first. As a matter of fact, yesterday I was at a meeting with several organizations and we were talking about food security. And they already have to prioritize now housing and then food, getting food on the table. And now, by the way, they have to deal with an increase in healthcare cost. And we have seen for a while that families really have been doing the preventive care that they need by participating in the Affordable Care Act. And so it has been helpful to our community. And so what these cuts would mean is, one, of course, a rise in the uninsured visits. And then two, well, I mentioned preventive care already, preventive care delays already, but then think about what that does to chronic conditions and how it worsens them. And I'll give the example of how in San Antonio and in the South Side in particular of San Antonio, we have a lot of asthma in our area. So think about not preventing asthma. We also have diabetes. Unfortunately, even in children, we have a lot of pre-diabetic children. And what we do in terms of prevention is really help them not get to that level that then, that it causes all sorts of other complications. Not only this, but this would add to our safety net providers, and our nonprofits do an incredible job. They try to be there and as much as they can, but they're going to be already stressed. And beyond that, also the hospital system. When you think of San Antonio, for instance, and where we are in our place in South Texas, a lot of the neighboring towns and villages and cities, they come to San Antonio for help. And as a matter of fact, when you divide San Antonio in half, when you come south of Highway 90, there's technically only one full service hospital. And for the residents of San Antonio alone, that's 0.7 hospital beds that are staffed. And so this is going to cause a tremendous staffing, I would say, complexity, right, for the healthcare system in general. But we also think about the health of our economy, because some of us think in terms of the economy and how that affects it. Well, guess what? If children are sick, parents have to stay home, which means that somebody is not doing some work. And so when we think about labor and the access to labor, the lack of access to labor right now, we're at a stressful point all around if we don't take care of our health, and in particular our children's health in this case.
Very good. Doctor Rocha García, ¿nos puede hablar un poco en español sobre esto? ¿Qué es la cosa que va a ser más difícil para familias si esta ley se pasa o si no ponen dinero en el sistema?
Si no invierten dinero en el sistema, los niños aquí en todo Texas van a sufrir, van a ser los que sufran más. Sabemos que hay ya niños que tienen enfermedades como el asma que tiene que ser tratada, enfermedades crónicas que pueden ser ayudadas con estar yendo a sus médicos regularmente, que se puede controlar con ayuda médica. Lo que pasa es que las familias van a tener que escoger entre o pagar la renta o pagar la comida o pagar el costo médico. Entonces, cuando lo pone en términos de qué prioridades van a ser para estas familias, desafortunadamente dejan las familias que la salud venga al último. Ellos tienen que tener o proveer para sus hijos un lugar donde vivir y luego tienen que proveerles comida. Entonces sabemos que eso va a afectar la salud de la economía también, porque luego quizás los padres de familia tienen que quedarse a cuidar los niños. Sabemos que en las escuelas hay muchas enfermedades que se pegan, que se transmiten. Entonces es muy importante realizar los créditos o ayudar una extensión y decir que necesitamos esto porque es para la salud de toda nuestra comunidad.
Gracias, Dr. Rocha Garcia. Dr. Barnes, I wanted to ask you a follow-up question. One of the things that this has been sort of painted as a political picture, right? With, one side saying politically we can't do it, it's not a good system, it's too expensive. The other side saying we need to do more. Maybe we should follow examples from countries that are doing a different job. But in the end, I know that what you guys care about, what we care about, is just how do we take care of children and families. And the reality is that, and you mentioned this, rural counties, Republican voting counties, this is really affecting all. When we think about 65% of all the families in Texas are low income, classified as low income families.
Right.
This is a lot of people that are impacted by this.
No, it's absolutely true. And, I'm going to put my doctor hat on as
Yes,
well.
please. Yeah.
We've alluded to the fact that people will have to make difficult choices about whether or not to pay for healthcare or for other basic necessities. We've done a poll over the last 6 years at EHF on affordability and accessibility. And the majority of people say because of cost, they've either delayed or avoided going to the doctor, which means that their illnesses progress to the point that the only time they access the healthcare system is when there's an emergency. And that's the highest cost care that we can deliver. When you talk about rural communities that already are underserved in terms of healthcare, not having an insured population, or at least part of your population insured, means there's no revenue going into the facilities that are there. And that's part of the reason that we're seeing such a significant closure of healthcare facilities in our rural communities. And certainly that is not good for anyone's health. And I think we have to pay attention to the whole system. We can't pick and choose sort of based on our views, what's right or wrong. All of these changes are going to affect all of us. If our ERs are packed with people, if I have a heart attack or if you have a stroke, those ERs are not going to be able to serve us as readily because they're going to be people with preventable conditions there. So yes, this is a all of Texas and all of Texans issue.
And I mentioned this at the outset. We seem to be forgetting that before ACA, counties and you as a physician worked in some of those county hospitals, right?
Yeah.
And we would hear from the county commission and the county judges that this is too expensive for us to do this, and this was all over the state. Talk a little bit about those expenses that would have to be absorbed by county health facilities.
Yeah, I think we've touched on uncompensated care multiple times, and our safety net health systems, like federally qualified health centers, like hospital districts and Harris Health here in Harris County, they serve a disproportionate number of individuals who don't have coverage. The loss of the subsidies will increase that number, and it means that hard decisions are going to have to be made, right? Do we have to scale back services on what we're able to provide to meet the increased demand without a matching revenue? So absolutely, it puts a huge strain on these very necessary health systems and could lead to, the reduction of services.
Yeah, thank you so much, Dr. Barnes.
Mm-hmm.
Mary Gar, in San Antonio, you with Family Service, you're dealing with families on the ground day in and day out. I'm wondering, from your perspective, you see these families, many which have chosen not because Texas did not expand Medicaid. Many of them did not choose to do insurance anyway, but many did do insurance. What do we see in terms of if you have even more uninsured, what's that going to look like in San Antonio?
So, we know how high the rate has been in Texas for those who've been uninsured and how much this has helped bring that rate down and improved not just access to care, but health status. We're at risk of undoing all of that here. And when we see that, with our families who are struggling, I want to go back to Dr. Barnes's comment, that health systems, it is a system of care, but it's a fragmented system of care for us. And the best way for people to access care is through the preventive aspects and through their primary care providers, and then receive higher level of care as needed. But too often for our poorest and uninsured, they are ending up in the emergency room after things have happened and progressed so far along that that visit is enough to bankrupt them. But then anything follow on is so far along because they now have full blown diabetes. They're now in stage 3 or 4 cancer. They now have heart disease. They now need a liver transplant. We see these things. We have over the years with our clients. It has gotten better in recent years because of the Affordable Care Act and because of the subsidies where people are able to access sooner. And as Dr. Rocha Garcia mentioned, our healthcare system is part of a larger ecosystem tied into having adequate access to be able to work, in the job sector, to have affordable housing, safe and affordable housing, and safe and affordable neighborhoods with all that infrastructure, having adequate schools, having, adequate food. All of that is an ecosystem here. Healthcare is a piece of it. When we start chipping away again at healthcare, we are affecting every other aspect of that. And to Dr. Rocha Garcia's point that, when you look at the nonprofit sector, that quote unquote social services sector, that's really what you see in what they call upstream health. What can we in the community do to help keep people healthier up front? So when they do need to seek healthcare, it's for things that couldn't have been prevented. But too often what we're seeing are families that have a poor health status for reasons that absolutely were preventable and avoidable, and at a much further stage along that's more expensive, not just for them, but as you noted, Dr. Sanborn, we all pay for that cost of care. That becomes uncompensated care. That becomes lost workforce productivity. That becomes children who now have lost that future life potential to be engaged in community and be happy because we have not given them those supports right up front. We see that with the families we serve. I look at nonprofits, though, as really canaries in the coal mine. We see less resources available to support nonprofits. At the same time, more individuals and families are needing those very services and supports. And so, that's a confluence of factors coming into play that at some point, more things are going to break. And the ones who are going to be hurt are those children and families with their health, with jobs, with housing, with everything that supports our communities. We've got to be able to come together, and keeping these subsidies is one of those ways to ensure that our children and families can be healthier long term.
Yeah, thank you so much. I think the thing that I want to emphasize the most is that our legislators are making in their minds a political decision. And what we're saying is that we need to take politics out of this. We're in Texas. Texas is a conservative state. Whether you're a Democrat or a Republican, you're conservative. And I know we don't want to think about the idea of subsidizing some things in our life. But the fact of the matter is for us to have that strong economy that we love in Texas, we need to make sure that our residents, our children, our families, that they have access to good health, that they have access to good health insurance. And this is the way to do this. I don't see another realistic option on the horizon. I think when that comes along, I think all 4 of us here are going to be happy to look at that and say, this might work, this won't work, but we don't have that other option. The option for families and children in Texas right now is to make sure that ACA is subsidized and that our children and our families are getting access to health care. And I think that's very simple for us, right? We don't want those decisions to be made on politics. We want them to be made about what is best for our children. I mentioned 65% of our families are low income families. These are the families that are going to be impacted by this. And so I want our public leaders to see that this is the decision for all of our families, all of our children. So I want to thank each and every one of you. Dr. Ann Barnes from Episcopal Health, thank you so much for being here. Dr. Adriana Rocha Garcia, thank you very much. Mary Gar, as always, the work that you guys do at Family Service, thank you so much. And as always, for the press, thank you guys very much. And any one of us are going to be happy to follow up with you guys with any phone calls if necessary. Thank you all very much. Thank you.
Thank you.